Good afternoon, everyone. Thank you very much for joining us today. We're very honored to have two very special guests. Brenda Kelly Nellum from Woodbridge, Virginia. She is a beneficiary of Medicare, but she has made such an enormous contribution, and she will tell you about that. And our other very important person is Sam Burnett. He's a Medicare beneficiary and a caregiver. He's from Toledo, Ohio, but he was raised in Baltimore, Maryland, so I have to tell you that. We are also joined by many of our members of Congress, three who are spearheading this conversation this afternoon. Congresswoman Doris Matsui of California is a co-chair of the Senior Task Force. She will be joined by Congresswoman Jan Schakowsky, who's on the floor right now, but she will be with us in a moment, and Congressman Chaka Fattah, who is with us right there from Philadelphia. Thank you, Chaka, for your leadership. This Saturday, we're coming together to celebrate what is happening this Saturday. Our nation will mark the 46th anniversary of Medicare. When President Lyndon Johnson signed the bill on July 30th, 1965, he said, and I love this statement, so I'm going to read it, "No longer will older Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings that seniors have so carefully put away over a lifetime so they might enjoy dignity in their later years. No longer will young families see their own incomes and their hopes eaten away simply because they are carrying out their deep moral obligations to their parents." For the last 46 years, that's when the bill was signed, it has been the responsibility of elected officials to preserve and strengthen that promise. Today, we come together to stand strong for that promise. We come together to stand strong for Medicare. Over the years, we have celebrated the anniversary, but today we come together not only to observe the anniversary, but also to protect Medicare. Republicans are determined to balance the budget on the backs of our seniors. Last week in the House, the vote was taken on a Republican plan which we call Cut, Cap, and End Medicare. It would end the Medicare guarantee, forcing seniors to pay at least $6,000 more for health care while protecting tax breaks for big oil, for special interest, corporations that send jobs overseas. That simply just isn't right. Seniors pay more, oil companies get subsidies. This week, we will vote on the latest Republican bill proposed by Speaker Boehner that will end Medicare, cut Medicaid benefits, and jeopardize Social Security. Protect the top 2% of Americans at the expense of 98% of the American people. That's just not right. They want to pass a short-term deal on the against defaulting that would lead to a credit downgrade, higher interest rates, and a tax hike on every American, because that's exactly what an increase in interest rates would be on credit cards, home mortgages, car payments, you name it. And then it would end in 6 months. So we would immediately start this discussion again. It's just not right. On the other hand, Senator Reid, the leader in the United States Senate of the Democrats, put forward the responsible plan to reduce the deficit and that protects the middle class and Medicare, Social Security, and Medicaid beneficiaries. It also includes many proposals already proposed by the Republicans. They just won't take yes for an answer. If we don't come to a conclusion soon, Democrats in the House are saying we must pass a clean debt ceiling bill while continuing our discussions, as we know we must, to reduce the deficit. The time is long overdue for this debate to end, for us to get to work, to address America's number one priority, the creation of jobs. The creation of jobs. The creation of jobs. Let us come together for a balanced, bipartisan solution which reduces the deficit, protects the middle class and Medicare and Social Security and Medicaid beneficiaries, that does not impede our economic recovery and the creation of jobs. Let us come together again to create jobs. So thank you all for being with us today. I'm honored by the presence of each and every one of you. We're especially honored by the presence of Brenda Kelly Nellum. She has been honored and recognized in the Oval Office. She'll tell you why. We're awfully glad she's here. Please welcome Brenda.
Hello. I hadn't planned to talk about my honor in the Oval Office, but I was honored in December for my work for payments for doctors for Medicare and military. And we got that bill passed for a year. I worked on that. And so that is an honor. But I'm here to talk about something else today. Hello, my name is Brenda Kelly Nellum, and I am a member of the Alliance for Retired Americans, and I live in Woodbridge, Virginia, and I'm a Medicare beneficiary. I am honored to be here today with Leader Pelosi and other members of Congress to celebrate the anniversary of Medicare, which I believe is one of the country's greatest success stories. I have been fortunate to receive Medicare benefits the last 3 years. Because of Medicare, my husband and I can afford to see our doctors and fill our prescriptions. I never forgot when I first enrolled in Medicare. I had a simple outpatient surgery. But when the bill came, it was $10,000. But because of Medicare, I did not have to struggle to pay off that bill. Medicare helps seniors afford their health care. Can you imagine what it would be like if we had to rely on private health insurance? Even if a company would sell us a plan, I don't know how a senior could afford it. 46 years later, in 2011, Medicare is doing its job it was designed to do, and it is better thanks to the new health law. And it will be easier for seniors to afford our prescriptions and to visit doctors for preventive tests and screenings. I'm really grateful for Medicare. We need to do everything we can to preserve the program, support it, and never allow cuts to take place. Seniors like me are very worried by the talks of cut for Medicare. Certainly we could be more vigilant about fraud, waste, and abuse in this program, but we cannot cut coverage that seniors rely on. I'm so glad to see all the support in this room. Our nation's seniors and for our nation's seniors and for preserving Medicare. Let's celebrate its many successes and keep it strong for years to come. Thank you.
As I mentioned earlier, the co-chairs of our seniors task force, Congresswoman Doris Matsui, and now with us, Congressman Jan Schakowsky, are here. A couple of weeks ago, we had a visit with the press to talk about the impact of any reductions in Medicare, Medicaid, Social Security, particularly on women. At that time, we had with us the person who was then the newest member of Congress, Kathy Hochul, and she spoke. Today, we're very blessed to have with us the most senior member of Congress, Congressman John Dingell, who will join us at the podium shortly. And so I would like to yield the floor to Congresswoman Doris Matsui of California.
Thank you. Thank you very much, Leader Pelosi, and thank you for your steadfast commitment to seniors. All of us appreciate working with you. Now, for 46 years, Democrats have defended Medicare. It's in our DNA, and we stand here ready to continue that fight. Over the past several months, I've heard from thousands, I really mean it, thousands of my constituents who voiced concerns about the Republican attacks on Medicare. They do not want and will not stand for cutting benefits to allow Wall Street executives to maintain low tax rates or to continue to provide subsidies to big oil. Take Mona, for example. Mona started working as a teenager and has paid into Medicare as long as she can remember. Now, as a beneficiary, Medicare is making the difference in her ability to make ends meet. But if Republicans had their way, Mona's financial security would be eroded. I've also heard from Paul, who has a young family, and Paul, who is concerned about his parents, who are both Medicare enrollees. He said, and I quote, "I don't know what we would do to cover the costs of their medical needs if the program was cut. Thank you for standing up to those who think vouchers or privatization is the answer to Medicare. It is not." David, a disabled Vietnam veteran and recent retiree, is scheduled to start receiving Medicare benefits next month. I think he summed it up perfectly when he said, "The Republican Medicare plan is meant to divide and conquer." So let's be clear. Default crisis should not be an opportunity for House Republicans to force through ideological cuts. Our responsibility to America's seniors, the middle class, and future generations is just too great. Now, it is my pleasure to introduce Sam Burnett. Sam, who is a school administrator from Toledo, Ohio, who's a Medicare beneficiary and also a volunteer caregiver. Sam.
All right, Sam. Thank you. What a joy to be here, to see so many people that care this much. I guess I'm here to do two things. I'm Sam Burnett, and I'm from Toledo, Ohio, and I'm with the National Committee. Oh, I forgot that. Yeah, we were talking about Baltimore as we came in, and crab cakes, and we may have to eat those together. But I'm with the National Committee to Preserve Social Security and Medicare, and have been for 10 years. And after I left the job of school, I went to work for the church. And in that process, I saw so many seniors that survive on Medicare and Medicaid. And in that process, I'm also with the Alliance for Retired Americans. So in that process, I represent about 7.5 million seniors who read and write. And all we're asking people to do is to do the right thing. I'm a Medicare beneficiary. I'm 80 years old. And in that process, I've seen so many people. Who would have thought I'd have got a hand for being 80 years old? They said, you don't live that long and be that fat, but here I am. But anyhow, we've had a ball. As we find the seniors who need that service, Medicare has provided that over all those years. And I can't tell you, 46 years of service to so many seniors is very significant. And while I'm here, again, we're just asking the members who you see behind me to do the right thing. Protect Medicare and protect it and make it sure so that my seniors are not worried and concerned about it. And as I met just Sunday, I had 3 or 4 people come up and say to me, are we going to get our check? Or are we going to have our medicine? Are we going to be able to go to the hospital? And the answer is, I think we will if we have these people to help us do that. My last comment at church on Sunday, I had a couple that were celebrating their 69th anniversary. And they only got that way because of what we have done as a great government, a great country, and we serve those people, and we need your help to do that. And what a privilege it is for me to be here and tell you it's a great country, it's a great program, and let's keep it and even improve it. Thank you.
What a good Thank you so much. I'm Congresswoman Jan Schakowsky, and in addition to representing a district in Illinois, for 5 years in Illinois, I was the executive director of the Illinois affiliate of the Alliance for Retired Americans. So I proudly bring that credential with me. Last year, we gathered in this very room to celebrate the 45th anniversary of Medicare and Medicaid. And we had cakes and balloons, and we heard from Americans whose lives were made so much better because they could depend on Medicare and Medicaid. And last year, I talked about what it was like before Medicare, when being old meant you were probably uninsured, when you didn't get medical services unless you or your children had money in their pockets to pay for the care, where private insurance companies set the rules and determined who they would insure, for what services, and at what cost. Today, we're gathered to mark the 46th anniversary, but without cake or balloons. We still hear from Americans on how they rely on Medicare and Medicaid, but we're not in the same festive frame of mind as we were last year. Instead, we're in a fighting mood, and we're here to tell those who don't cherish Medicare or Medicaid, as we do, hands off. We will not let you. We will not let you destroy our national treasures. We will not let you take us back to the bad old days of the last century. And not all of us were present at the birth of Medicare, although I believe that John Dingell was actually in the chair at that time. But not one of us is willing to be present at its demise. Am I right? We are not going to let a Republican plan to eliminate Medicare go into effect. We're not going to let the Republicans double and then triple seniors' out-of-pocket costs at the same time, by the way, that they want to cut Social Security benefits. Many Americans are hanging on, just waiting until they turn 65 so that they can finally become eligible for Medicare's guaranteed coverage. They put off going to the doctor or getting needed prescriptions or surgery because they simply can't afford it. And we're not going to raise the age of eligibility so that they have to wait even longer. And above all, we're not going to turn Medicare's guaranteed benefits into a handful of inadequate vouchers, throwing seniors back on the mercy of the private insurance companies. My Republican colleagues like to say that they aren't eliminating Medicare. They're just changing it. Well, I say you can call it whatever you want. Maybe care, sort of care, I don't care. But you cannot call it Medicare. So this year, we're not having an anniversary party, but a recommitment ceremony. We're here to state our fierce and unswerving commitment to protecting and preserving Medicare and Medicaid so that we can go back to celebrating it with cakes and balloons for generations to come. Thank you. And now it's my pleasure to bring on my colleague Chaka Fattah.
All right, Chaka.
Well, I don't believe that we can honor the greatest generation by allowing this Congress to become the default generation. We are the wealthiest country in the world. We can afford to take care of our responsibilities. And highest on that list is our responsibilities in terms of our senior citizens who have done the work to build this country. We are the most powerful country on the face of the earth. And Sam, I applauded you because you're 80. You know, my mom is now 80. She's been in the hospital for a couple of weeks, but she's coming home this week. And but that Medicare is what allowed her not to be stressed out about being hospitalized. And my dad was, he was there with her every minute. They had to move him out of the way so they could attend to her. But the point is that Medicare is a commitment that we have, and we're not going to allow this Republican majority to lose the moral compass for our country. We're going to focus on this, and we have the right leadership. Nancy Pelosi is the best speaker the Congress has ever had. And she's made it, and she has made it abundantly clear, and I'll conclude with this. We will not equivocate. We will not compromise, not 1 inch on Medicare, period. Now, we'd like to find some ability to go forward with this Republican group that's here to, you know, solve a few of these problems for the time that they're going to be around. The way they're acting, they may not be around for a long time. But there's no ability for us to agree on anything that takes away benefits to people like my dear mom, who, like Sam, is now 80. But she said, I'm not waiting around here just to expire. I got work to do. Thank you very much.
Thank you very much, Chuck. Congresswoman Matsui, Congresswoman Chakowski, Congressman Fatah. As I mentioned earlier, and as Congresswoman Chakowski alluded to, our distinguished Dean of the House of Representatives, Congressman John Dingell, was in the chair and gavelled down the Medicare vote. And he has that very gavel that he used to do that. We're very honored he's with us today and invite him to say a few words. You'll see members leaving because they called votes. But as he comes up here, I want to acknowledge a former colleague, Congresswoman Barbara Kennelly, who also was the head of the Committee of Preserve Social Security and Medicaid.
You don't mind if I call you Madam Speaker, do you? They're going to give her back the job. Because Medicare and Social Security have got to be protected, and that other side ain't going to protect it. But this wonderful woman will. We thank you. Well, I was sitting in the chair when we passed Medicare, one of the great days of my life. And it was one of the great days of most Americans. I didn't realize it when I was a puppy then how important it was going to be when I got to be 85. Well, it's a great program, and it works. And it's worth protecting. It's a commitment, and it's an insurance. It's an insurance that protects our people. It's a commitment that we're going to take care of them. And we're not going to let them take it away or give us a bunch of shrunken vouchers in their place. So, Madam Speaker, thank you for getting us together. Remember, much is to be done. We have to protect Medicare for our future and for those who have it now. We also have to protect Social Security. The same folks who are out to destroy those two programs in their inception are still busy trying to do the same thing. So, let's get at them. We aren't going to quit while they still have their heads up. So, keep going. Bless you, Madam Speaker. Bless you.
As I mentioned, we have votes, so I only have time for one or two questions. They weren't supposed to come until later. Any questions from the press? He has resigned. That's it. I said at the time that I pray for him and his family. Obviously, they have issues to address, and I wish him well. Well, let me say this. We all agree that we need to reduce the deficit because that's important for us to do. But as we do so, we want to make sure we have the right priorities. We don't think a right priority is to make seniors pay more for Medicare for fewer benefits while we give tax cuts to big oil. We don't think it's right for us to eliminate a senior's access to Medicaid, which helps them in nursing homes, while we give tax breaks to corporations that send jobs overseas. And when it comes to the next generation, we don't think it's right to make kids pay more for their college loans while we give tax breaks to the wealthiest people in our country. Having said that, in our in our Affordable Care Act, we did address the issue of how we can reduce cost in Medicare to strengthen the program to make it solvent for a longer period of time. What we're talking about is how we can reduce cost. One way we can reduce cost is to stop paying pharmaceutical companies nearly $100 billion more than we need to do and say that it's about, instead we want to reduce benefits. So, of course, we subject every initiative that involves so many people and so much money to the scrutiny as to where we can have savings. But those savings do not begin by increasing the cost and lowering the benefits to our seniors. Another question?
Are you comfortable with the Reid Joint Congressional Committee to look into evaluating deficit reduction?
Well, I would like to see it have revenue in it because I think that's a really important part of the deficit reduction. But I commend Leader Reid because he has created a path. Let me just say that over 30 times we have lifted the debt ceiling since President Reagan was president. Over 30 times. Not one time did we subject a president to this burden of saying we won't lift it unless we reduce the deficit. Of course we will reduce the deficit, but it should not be connected. And the idea of that we could jeopardize whether they're sending out Social Security checks or military checks, or that our credit rating would be affected by this is appalling. But I commend Senator Reid for trying to find a path. I commend the President for his patience, for his respect for every view, on Democratic or Republican view, giving it time, consideration, trying to make it work. I wish the same respect for his time and the responsibility that we all have was there. So I would like to see what that proposal is about the committee to include revenue as well, because if you just make cuts, you pretty soon will be cutting benefits. There's just no way that you can cut $3 trillion in domestic spending, especially when they don't want to have a firewall between domestic and defense. So we have some ways to do it that would truly reduce the deficit, enable us to grow our economy, create jobs, educate our children, honor the values of our country, a dignified retirement for our seniors, the education of our children, the creation of jobs, the security of our country, and while we reduce the deficit in a values-based way. With that, I'm going to have to go vote, but I thank you all for coming. Are we all set to protect Medicare, Medicaid, and Social Security? We're together on that, are we? Thank you all very much for being here.